All right, how's it going out there? Once again, it's David Rotano, going back over your drug math. This time we're going over drips. Drips are one of my favorite. Why is it one of my favorite? Because it's very easy to do. And after you get this, I'm going to show you how easy this can be. A lot of misconceptions about drips, how it's hard, how I can't do it, I want to pass a test. What I'm going to do is I'm going to show you how we're going to break it down and then use it for patient care. I don't care if you can pass a test. I care about if you can treat a patient or if you can come up with a correct calculation and the amount that you can do to give a patient. So let's make this as simple as possible. All right, let's start. We're going to be going over drops per minute. Why are we going over drops per minute? This is why. Right there. This is what we see when we're treating a patient. Drip, 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 drops per minute. This is what treats a patient, not taking a test. Drops per minute. I'm going to go over one of my favorite medications as dopamine. Now it depends on your protocols and depends on how you have it supplied. This supply right here, dopamine, 400 milligrams in a 250 milliliter bag. That comes up with 1,600 micrograms per milliliter. How do we know this? Let me show you right there. 400 milligrams, dopamine. It's a 250 milliliter bag, it's 1,600 micrograms per milliliter. Remember that one right there, 1,600 micrograms per milliliter. That's going to be your bread and butter right there because you can see it. Here's the first formula. Here's how hard it is. Check it out. Desired dose, time to drip set, divided by your medication per milliliter. Remember this? Medication per milliliter, what is it? 1,600 micrograms. Okay. So desired dose, time to drip set, divided by medication per milliliter. So far you got it in your hand, your patient assessment, your skills for patient assessment, that's going to be all you. What's your protocols as far as dopamine? 2 to 5, 5 to 10, 10 to 20 microgram per kilogram a minute. That's going to be your assessment. So what you're going to use, that's going to be up to you. All right. So let's get some examples going. I like to kind of turn things around a little bit because I hate charts, especially with dopamine, because I want to be able to use whatever numbers I want. I don't want to be restrained by a chart. So 5, 10, 15, 20 micrograms per kilogram a minute, I want to use 2 to 20 micrograms. I can up it, I can down it, I can make whatever changes I need to on the fly. No problems. I'm going to use 7 mics per kilo. And I'm going to have a 75 kilogram patient. This is going to be 525 micrograms a minute. That's how much I'm going to give. So far, no biggie. Okay. 7 times 75 is 525. We good so far? All right, let's see it a little bit further in it, okay? This is what it looks like. 525 micrograms. This is what we're going to do per minute. Times my drip set, which is a what? Yep, a 60. Divided by our microgram per milliliter, which is 1,600. So 525 times 60 divided by 1,600. Look what it is. 19.6875 drops per minute. I know what you're thinking. I can't do the rest of the numbers past 19. Do what you need to do. 20. If you want to round up, no problem. If you want to round down, hey, no problem. Okay?